Well, hi, everybody, and welcome. Today is Monday, March the 1st, and welcome to our director's Zoom formation call. The photos that you saw just now were photos that were taken by Rotarians from District 7330 who made trips to the Dominican Republic in order to install biosand filters. I think you all know that March is on the calendar, the month in Rotary that we celebrate water, sanitation, and hygiene. And of course, it is one of our areas of focus, so it does get the attention of our members. It's my great honor today to be the one who gets to introduce our cameo guest. Ron Denham has been a passionate Rotarian for over 60 years. And no, I haven't known him for that long, but I know that he is passionate about water. He has many Rotary achievements, including being awarded the Service Above Self designation and also the Citation for Meritorious Service. When Glenn Estes was president in 2004, he appointed Ron to the position of General Coordinator of the Water Resources Task Force. Because Ron has a background in engineering and strong consulting skills, 3 years later, he took all of that experience and launched WASRAG, the Water and Sanitation Rotarian Action Group. Originally, Ron was chair of that group, but now he is chair emeritus, and he leads the group's professional resources team, advising them on all aspects of sustainable WASH projects. So please let me welcome my friend and a Rotary water, sanitation, and hygiene expert, Ron Denham. Ron, it's yours. Please unmute, Ron.
Quite sure what's happening here. Okay, I think I'm unmuted now.
Yes.
Thank you very much, Stephanie, for that introduction. And fellow Rotarians, brothers and sisters, all in Rotary, good morning, good afternoon, good evening, wherever you are. In this brief 5 minutes, I'd like to talk to you about a new movement, a new initiative which is taking place in the humanitarian world. And I refer specifically to water, sanitation, and hygiene in health care facilities. Most of us, when we go to hospital, expect safe treatment and hopefully a swift recovery. But in sub-Saharan Africa and many countries in the developing world, that is a misplaced hope. In fact, in many cases, you actually contract a disease or an infection. Too often, you leave in a coffin. The lack of water, sanitation, hygiene, and waste management and cleaning pose a threat to every patient. It promotes infection and undermines every effort to improve maternal and child health. The World Health Organization and UNICEF report that about 900 million people use health care facilities without any water service. 1.5 billion use facilities that no adequate sanitation, and many more like hand hygiene service and safe waste management. To illustrate a few examples, in the least developed countries of the world, only 55% of healthcare facilities, that's hospitals, clinics, nursing stations, had basic water service. 12% had no water service at all. More than 1.5 billion people had no sanitation service at their health center. And in sub-Saharan Africa, only 23% had basic sanitation. In short, a grim picture. 16% of these hospitals and clinics had no hygiene service, no hand washing facility with soap and water, not even in delivery rooms or operating theaters. The implications are clearly very serious. A recent study by World Health Organization and UNICEF stated that 15% of patients in developing countries contracted infections in a healthcare facility. Poor hygienic conditions and lack of hand washing facilities are the major cause, and that's especially critical now in times of COVID-19. In fact, you might say a healthcare facility without wash is not a healthcare facility. Here then is a huge opportunity for Rotary clubs. Rotarians, Rotaractors, and Rotary Community Corps are well placed to lead a wash in healthcare facility project. We have credibility because of the success of polio eradication. We understand the values and culture of a community better than outsiders. We know what will work. We can organize. Change may be needed at a political level. We understand the political temperature. We're part of the power hierarchy that makes things happen and gets results. And we have a range of skills, such as financial, medical, technical, and managerial, needed to bring about change in the healthcare situation. Together with other organizations, we can achieve the goals agreed to by the World Health Assembly. 50% of all healthcare facilities to have basic wash services by 2022. That's next year. 80% by 2025, 100% by 2030. So clearly, there's an opportunity for Rotary, and I see the agenda including helping healthcare facility staff to develop wash priorities, prepare plans and set budgets, build easy to maintain, gender separated, sustainable toilets and latrines, install hand washing stands, implement water infrastructure, boreholes, wells, filtration, the kind of things that Rotarians are doing all the time. Advocate for funding for long-term sustainability. Fund menstrual hygiene management programs and materials. Design and implement training programs to build capacity. Implement behavior change. Oversee monitoring and evaluation to ensure a lasting ability to provide service to the community. The scope might be limited to physical facilities, which is so often the case in Rotary, but we must always think about software, building human capacity to ensure a lasting ability to deliver integrated wash services forever. How to go about it? Where to start? Well, wash in healthcare is first and foremost a healthcare issue, not a wash issue. So ensure that Rotarians with a public health background are included in your team. Then engage the healthcare community, the medical and all other staff in the facility, plus the local health authority and the community. They will all be involved in any change. They must take ownership from the outset. Working together, you'll identify gaps in wash, agree on the most appropriate solution, and bring in other partners, Rotary clubs, non-governmental organizations, donors, etc., and of course, the Rotary Foundation. The WASH Rotary Action Group, formerly WASRAC, can help you. We share your passion to improve the lot of those in need. We provide a professional assistance in planning the project and preparing submissions to donors. We can seek funding for your project or program from other clubs, the Rotary Foundation and other donors. We can help identify international partner Rotary clubs, and through the newsletter, promote your project among over 50,000 Rotarians. In conclusion, COVID-19 has highlighted the need for cleanliness in all healthcare facilities. The need for wash is urgent. Never was there such an opportunity for Rotary commitment. Will we rise to this challenge? I hope so. Thank you.
Thank you, Ron. What an awesome presentation. In such a short space of time, you've encapsulated so much information. The session is being recorded and it will be available afterwards. David will see to that. But I hope you'll share your presentation because that was just awesome. And the plan of action, the challenge, we are truly indebted to you, Mr. Water of the Rotary world. So thank you, Ron. I hope you'll stay with us. I'm sure there'll be some questions at the end of the next presentation. So it is now my pleasure to introduce two of our area focus managers. The first is Erica Gwynn, Erica is the area focus manager for the water and sanitation area focus. She's been a technical advisor and program manager of the water, sanitation and hygiene portfolio at Rotary International for the past 8 years. In parallel, she leads the Rotary International USAID WASH partnership, Rotary's second largest strategic partnership, with over $18 million invested by the Rotary Foundation and USAID in 4 focus countries. She holds 2 master's degrees, an MPH in environmental toxicology, MS in watershed management from the University of Michigan. Prior to Rotary, Erica spent 7 years in research and development within the public and private sectors, working and residing mainly in the Pacific Northwest, United States, Mexico, and Uganda. We're delighted to have you with us, Erica. The floor is yours.
Thank you so much, Director Kyle. Hello, everyone. It's a pleasure to be with you today. I'm going to go ahead and share my screen. And I hope you are able to see the very first slide that's talking about the global water and sanitation crisis. So let's start there. Ron provided an excellent overview, so I'm going to run through a few statistics that I think are quite startling. Even in 2021, we've been working in this area for decades now, and yet the crisis is even bigger before. And why this is important, as we'll see, is that this impacts all other areas of focus, including education, health, community economic development. So this is really what I call a keystone area within Rotary. We know that 3 in 10 people lack safe drinking water in their homes. Still today, we know that 6 in 10 people still have lack of access to safe, hygienic toilets at home and sanitation practices. That's incredible. And the results of this lack and deficiency across the world globally, and the United States, North America is no exception. These challenges still continue to be within the United States. We are experiencing by 2050, some regions could see their economic growth decline as much as 6% in GDP as a result of water-related losses in agriculture, health, income, and property. And that's incredible if you think of it that way. That's why Rotary has made water, sanitation, and hygiene and water resource management essentially an area of focus. So today, what I'm going to talk to you today is about one of our areas that we can really testify to our impact and the challenges also as well that we've had working in the area of water, sanitation, and hygiene. That is our relationship with the United States Agency for International Development, which has currently been a 12 going on to 13-year relationship initiated by our very own Ron Denham, who's still a part of the steering committee, and past President Bill Boyd. This partnership aims to leverage the technical expertise of USAID missions, which are country offices, and Rotary's expansive network of influential volunteers to increase sustainable access to water and sanitation services through local ownership, civil society engagement, and that's where Rotary comes in, technical expertise, and networks of influence. Together, we decided that this unlikely partnership, a civil society organization, membership organization, partnering with this one of the largest global development organizations, we decided that we actually could complement each other. And doing so, we decided that our focus would be in delivering sustainable access to safe drinking water supply and sanitation services, really making sure that we prioritize the improved behaviors that must accompany any sort of service provision that we provide, so that we can guarantee or have a higher likelihood of those positive outcomes that we wish to see in the other areas of focus. And thirdly, we focus on advocating specifically for environmentally sustainable, locally appropriate, and effectively financed water and sanitation services. And as Ron said before, that last point of financing for water and sanitation service is really critical in most countries. We all are Rotarians, so we're familiar about the added value that Rotary can bring to the table. But why did Rotary even consider partnering with the U.S. Agency for International Development? Well, we found a common bond there. And not only did we have this vision for bringing sustainable water and sanitation services to global communities and the reach that we both had in different ways, but we saw that within USAID, they were aiming to strengthen sector governance and mobilize innovative financing. So that definitely overlaps with some of our advocacy initiatives. They wanted to increase sustainable access and use of sanitation and promoting the practice of key hygiene behaviors. And they also wanted to increase safe drinking water, sustainable service provision. And they wanted to look at the larger vision of how do we improve, preserve, and manage our water resources that allow us to have these services to begin with. So we took a look at each other and we found the added value within Rotary, which within Rotary, we really have a unique aspect to us. And we really need to recognize this. We're leaders of civil society. Not only do we come with our vocational expertise and professional leadership, but we also have these vast networks of influence. And we can utilize those vast networks of influence to truly build strong connections and influence within the public and private sectors. We've seen already demonstrations of how Rotarians within polio have been able to strongly mobilize resources. And resources are not just financial, right? Resources are also expertise, human resources that are critical for the ongoing service provision that we're aiming for water and sanitation. Take this and partner it with USAID's technical development expertise, their strong government relationships, and their experience in strategic implementation of programs. And we saw this as a unique pairing. So today, our strategic partnership dedicates $2 million from each organization per country that we decide we're going to pursue a partnership in. This amounts to $4 million per country. And each of these partnerships must fit within this framework. One, they must be focused on water, sanitation, and hygiene, implementation, monitoring, and evaluation. That means we must be results driven to show the impact that we're having jointly together. We must have an innovation component. This can be innovative processes, innovative partnerships that we bring into the mix. But this third one that I really want this group to really understand is how important this is we have a civil society driven WASH advocacy strategy. This means that we have a formal advocacy strategy that aims to achieve the objectives for our water, sanitation, and hygiene initiatives. And that means Rotarians actually develop a plan where they collectively work together to truly advocate for the impact that they're looking to achieve. So how are partners selected? And how can our clubs and districts support these programs of impact? Well, in short, we have our RIUSAID steering committee. We take, and that is made up of not only Rotary leadership, but also USAID leadership. And we take a look at a high level of where water and sanitation is a priority already naturally on the ground within a country. So I'm giving you an example here in Guatemala. We're keeping tabs on the types of projects that are being done. How coordinative are these projects? How are Rotarians working together? Do they have a common vision? What skills, expertise, and networks of influence are they already utilizing in the country? And then we match this against the USAID mission's strategic priorities. And we look to see if there is a likelihood for a nice pairing. Now, that's as far as we go from the top. Now it's up to the country level, the Rotarians themselves, and then the USAID mission to come together and start working out a partnership that fits within the framework that I proposed to you earlier. And this is a really dynamic process of where the two sides come together, build a strategy of how they're going to truly implement their programming together, and decide what resources and how they're going to bring in other partners to the relationship. And this is where how we try to create demand going forward. So when you ask, how can our clubs here in the United States support these programs of impact if they're driven mainly by host clubs and districts? And I would love to follow up with you if you are interested in supporting this. Not only it could be financially, it could be with your expertise. We would like to talk with you. So it's a really nice fitting program. I would love for you to just have a moment where we could have more detailed conversation on the side. So please take down my email and we can follow up. Now let's look at this. What are the results? We look at what our program impact is through a monitoring and evaluation program. To date, we've invested over $18 million across several different partnerships globally. That's impacting around 450,000 direct beneficiaries from water and sanitation services that we provided. To date, we've had 4 official partnerships in the Philippines, Dominican Republic, Ghana, and Uganda. But our most active ones are in Ghana and Uganda. I'm going to give you a little bit of an insight of what is coming out of one of those partnerships. In Ghana, you can see we have several different indicators that we're following in this country. We're working not only in water and sanitation and healthcare facilities and schools, but also to bring safe water and sanitation to communities. We couldn't do this alone. We can only do this with a collaborative network essentially of partners led by USAID and Rotary, but inclusive of the government and other implementation agencies such as global communities. I really would like to go into more detail about this, but in interest of time, I'm going to keep moving forward to just show you that over 15,000 volunteer hours have been dedicated to this partnership. And if you equate that to what that means in terms of in-kind contribution, that far exceeds the $2 million that has been given formally via the Rotary Foundation and the volunteers themselves.
Erica, forgive me for interrupting, but we just have 1 more minute and then we have to move to the next speaker.
That's fantastic. Lastly, this WASH advocacy is really something to take note of. Our advocates have a formal WASH strategy that looks at things like trying to sensitize users about their rights as users for the services they're being provided. They work with duty bearers at the district level and also making them aware of their roles and responsibilities. And then they facilitate these two groups coming together in order to reach accountability mechanisms, which are really in need for Ghana in particular. This is true advocacy because Rotarians themselves are not the advocates. They're empowering the people that they're working with to be the advocates for long-term water and sanitation services. And I'm gonna leave it there. And I would just really like to say thank you so much. Continue to learn more about this relationship on our centralized learning platform at rotaryusadaywash.org, which will be released this month. And this is an awesome opportunity to hear the voices in the field, the learnings and the monitoring and evaluation impact statistics that we've been collecting. Thank you so much for the opportunity. Look forward to further discussion.
Thanks very much, Erica. This is a great presentation.
Mm-hmm.
We could talk for a lot longer on this subject. I've had some background in it. You're doing a fabulous job, and hopefully there'll be some questions in the Q&A. And you've noted your email address. Please reach out to Erica for more information about this amazing partnership. So now it's my pleasure to introduce our next speaker, also an area focus manager. Mary Jo Jean-Francois is the focus manager for the basic education and literacy area focus. She started out life working for state government, but then decided she would rather be a volunteer teacher in Haiti. And this decision led her to continued education work in Haiti, where she worked both before and after the 2010 earthquake. During her time in Haiti, she worked as the Director of Community Development for the Haitian Project, Country Program Manager for Outreach International, and she finished her time as the Education Manager and Educational Technical Advisor for World Vision in the Haiti office. Mary Jo also co-manages the Water, Sanitation, Hygiene, Wash in Schools Target Challenge partnership. This is a Rotary program piloting in 5 countries, focused on increasing enrollment of attendance of students, particularly girls in school. She has a BA in Political Science from Loras College and a master's degree in Public Service Management from DePaul University. Mary Jo, we're delighted to have you with us. The floor is yours.
Thank you, Director Peter. It's great to be here with all of you. I appreciate the invitation to speak with you today. And I just wanted to touch base quickly to talk to you a little bit about the Wash in Schools Target Challenge that Erica and I co-manage. So she is able to answer questions just as much as I am about this. This Target Challenge was born in about 2014 toward the end of Future Vision, if you can think back that far, for those of you who have been with Rotary for that long. And when Future Vision was coming to a close and we were getting ready to launch our global grant model globally, the Future Vision committee at the time said that they really wanted to explore a challenge for Rotarians that encompassed 2 or more areas of focus to see what sort of impact we could make in communities working with within both of those areas together. And so that's how this Target Challenge was born. And Erica and I worked with a committee, a Wash in Schools Target Challenge committee, led then by, at the time it was trustee Sushil Gupta, to plan this, this Target Challenge. Past President Mark Maloney was also a part of it, as well as other Rotarians who helped us to plan and design the Target Challenge. So you can see, uh-oh, my screens are not clicking. There we go. You can see that we selected 5 countries to pilot this program in, and we selected them based on their experience in doing water projects, water sanitation and hygiene projects, as well as education projects. And then we also wanted to make sure that we had some global diversity. And so we selected India, which has a huge portion of both WASH and BEL, B-E-L projects, Kenya, and then Guatemala, Honduras, and Belize, which all together make up District 4250. So we have India, which is made up of several districts, Kenya, which is 1 country in a multi-country district, and then 3 countries which make up 1 entire district in Latin America. Our Wash in Schools Target Challenge was funded through several different mechanisms. We utilized global grants, of course. Clubs did their own club service projects. And then we had a competitive grant process as well, which I will tell you a little bit about in just a moment. So traditionally, and this came about because Erica and I had been talking a lot about how our sectors both work within their own silos. And this is not just a Rotary problem, this is a problem globally where, you know, obviously education, the education sector is working in schools across the world to enhance quality education and for better education outcomes for students around the world. But I was also noticing during my time in Haiti and in other places that Wash in Schools was becoming a very popular project type because we kept facing the issue that girls could not come to school when they were menstruating. The communities did not have the right type of training in how to handle menstrual hygiene and simple hygiene issues. And then, of course, there's the issue of waterborne illness and other illnesses that occur because of poor hygiene. And so the WASH sector was working within schools as well to sort of enhance these educational outcomes, to have more kids enrolled in school, have them coming to school more often. But there was a gap there because we weren't too focused on the actual quality of the education once you got kids into school. And so we wanted to work together to look at both of these issues, not as singular issues, but as issues together. And so what we found is with our WASH projects in schools, there was a huge focus on toilets, access to water, hand washing facilities, the infrastructure, the things you could touch and see and feel. But there wasn't as much of a focus on behavior change, both for teachers and students. And so we wanted this program to not only focus on the infrastructure that we were bringing into the class or into the schools, but also bringing those lessons for students around hygiene and hand washing into the school curriculum as much as possible and integrating them into the curriculum. So we created what we believe to be a sustainable program. We utilized UNICEF's 3-star approach to WASH in schools. And we sort of, what we say, rotarized it. And so the UNICEF approach to WASH in schools had a big focus early on behavior change and later on infrastructure. And what we tried to do was not wait until the very end for the infrastructure, because we know that Rotarians are quite good at putting infrastructure into school spaces. And so we brought that to the forefront of this program, and we tried to incorporate it in throughout the program along with behavioral change components. And so if you follow the approach, you're ultimately building every school up to be closer and closer to not only a sustainable program where students are year after year having reinforced hygiene and menstrual hygiene lessons through their teachers, through conversations at the school, through lessons that they're having in the classroom, but you're also starting to change the system so that Rotarians, as you know, Ron and Erica both talked about, are advocating for more funding to go towards towards WASH in Schools programs, and more messaging to go out through the community and nationally around these issues. As I mentioned, we have a competitive grants program. It's just wrapping up now as our pilot is also wrapping up. It was a 2-phase competition, and it was funded by the Rotary trustees. The first phase allowed Rotarians to apply to do a community assessment, and we funded those community assessments up to $10,000. And we had 46 proposals to fund a community assessment. Of those 46, we granted 13 community assessment grants that we funded $10,000. And then those 13 applications had the opportunity to apply for phase 2, which was the full award amount of, I think, about $150,000 to $500,000. Of those 13, we selected 4 projects. Actually, sorry, 11 out of the 13 applied for phase 2, and we selected 4 projects, 2 in India, 1 in Guatemala, and 1 in Honduras. All of these competitive grants were working with cooperating organizations, and they are working in 239 schools total. These are just the projects that you can see. So some of the successes that we've seen, not just in the competitive grants, but globally with the Target Challenge, is that we see clubs cooperating and collaborating more with the Ministry of Education. We see more community members coming together to implement plans of action. And we see menstrual hygiene management really sort of rising to the top of a lot of these projects and becoming some of the most important things that these projects are doing. We've met a fair share of challenges though, and what we found is there are some struggles that Rotarians have with collecting data. This is something that, you know, understand Rotary is run by volunteers, and so they're not specialists in this. So there's an opportunity here to really do some training on monitoring and evaluation for Rotarians. Also still that balancing of the hardware and the software, the behavior change components has been a challenge for us. And last but not least, we had a hard time finding sponsors for some of our projects, which of course is something that I'm sure you all know about if you've ever done a grant at Rotary. It can be difficult to find the right sponsors for your projects. But ultimately, we felt like it's been a successful program. If you have any questions, we want to ask you to reach out to us. This is the contact information for Erica and me, as well as Isalia Ramirez, who has worked since the beginning with us on this program. So thank you very much for your time today, and I'm happy to take any questions from the group that you may have.
Well, Mary Jo and Erica and Mr. Water, thank you all for sharing your information and insights about this critical need that we have in the world for water, sanitation, and hygiene. You know, we all got a reminder last week about how this can happen anywhere when we listened to news about what was happening in the United States and Texas with so many people who had no access to water. So it really is an issue that, you know, can come home. I know that we have asked you to put questions in the chat box, and immediate past Director Stovall will review those in just a minute. But Mary Jo, I'm going to start with a question for you. Whatever happened to the Sesame Street puppet, Rhea, who was developed specifically to teach hygiene and behavioral modification for kids? Whatever happened to her?
She's still out there doing her thing. She's just not doing it with Rotary as much as she was at one time. But the Sesame Street workshop is still going strong. I think they have had some changes in leadership, which is probably why we haven't heard from them as much recently. But rest assured, Rhea is still out there, and she's working in communities around the world.
Well, that's good to hear. Past Director David, do we have any questions for our panelists?
Thank you, Director Stephanie. We do have one question. It says, we have a member in our district involved with Habitat for Humanity and USAID. Would Habitat become a partner also? And I'm not sure if that would be Erica maybe that feels that.
Yes, thank you. So interestingly enough, we're actually developing a formalized partnership with Habitat International. And that's really interesting, specifically in WASH. So we're calling this a service partnership, which means they don't receive any official allocation of resources from the Rotary Foundation. But we strategically are developing a framework similar to that of USAID. Now, to hear that they already have that relationship is really an advantage, right? Because both of our organizations know how best to operate with them once we have our frameworks developed. I can say that the way our operations work is that it's up to the USAID mission and the Rotarians in country to determine who the implementation partners are in this case. Oftentimes, those implementation partners are influenced by the restrictions that the US government has of who they can offer their contracts to. So if Habitat is in the country that we have a partnership in, I think the best way to determine whether this could be a possibility is just start having a conversation between all three organizations.
Thank you, Erica. The next question says, one of my Rotaractors is doing a water project in his home country of Rwanda this summer. Anyone in Rotary knowledgeable about that country and can offer him advice from staff?
So I just want to clarify, the question is country-specific technologies and programming. I think the best way to follow up with this question is offline, if he or she could be able to reach out to myself, erica.gwynn@rotary.org. But we also have an amazing, what we call WASH champions and advisory group within WASRAG. And Ron can provide further information in the chat box of where you can direct your questions to there. That's a wonderful resource as well.
Okay, and that questioner has already reached out to you with email, so we can take that offline and she can correspond, he or she can correspond with you. We have a question for Mr. Water. Ron, is ultraviolet light a legitimate method of sterilizing a healthcare space?
Yes, it is. It's one of many methods. And of course, it depends on the circumstance. It depends on the quality of the water. It depends on how turbid it is. But ultraviolet light is one of the methods. It's more expensive than some other methods. And before anybody committed to ultraviolet light, then we suggest that they look at various other methods, biosand filter, for example. And a simple example of the ultraviolet light application is what is called, it's a model in which you just use, take an empty Coke bottle and put it in the water. If it's not turbid, put it on the roof. And after 1 day on the roof, and this is typically a project we did in Kibera in Nairobi, and after 8 hours, that water is potable. And it works. And we did the same thing in Guyana, down there in Amerindian village, and the water there was terribly polluted. So we again had some empty Coke bottles, filled them with the water that was clear, it wasn't turbid, and it wasn't from the river, it was from rainwater roofs and so forth. Purified that for 8 hours, and then the fact that I'm still here is an indication that it was purified. So solar energy, ultraviolet light are all very, very effective methods. It should be looked at among all of the alternatives. There's no one right answer. You've got to take the local conditions, the local economy, the local capacity, for example, before embarking on any one of these solutions.
Okay, thank you, Ron. We're almost out of time, but we're almost out of time, but we have time for one more quick question. Ron, this is to Ron and Erica, just a brief response. Many on this call actually support hand wash personally. It's a big endeavor in zones, our powered zones, especially 34. Can you share your own personal involvement or how you're involved with this program? Ron, and then Erica.
Could you just repeat the beginning of that question, Dave?
You can call me David, Ron. Many people on this call are active supporters of hand wash. Can you just briefly share your involvement with the program?
Yes, I was appointed as an advisor early on for the hand wash program. And in that capacity, I've been particularly, I wouldn't say forceful, but keep bringing up the issue that we've got to raise this from being a Rotary project to a community project. It's a huge program, as you probably know. We're talking about $2 billion over the next 10, 20, 30 years. Too big for Rotary. Rotary is triggering it. So I keep stressing that point, but also I was asked to prepare some of the documentation on the environmental, the establishment, and also the software components. We in Rotary are extremely good on hardware, anything to do with infrastructure. We tend to overlook the software component. So my contribution in the early days was the software component and putting that in the overall program.
Okay, thank you. And Erica, how about you?
I mean, in short, I just have to say it's been my privilege to have been invited to be a part of the Hand Wash Initiative very early on, and I've seen it really be able to be growing and cultivated into eventually what is envisioned to be a large-scale program to cover all of Haiti. So I serve as an advisor with whatever capacity that they need me in, specifically for monitoring and evaluation. And I'm also fortunate to join other colleagues on this call as part of the board of directors.
Okay, thank you very much. And Mary Jo's interests are in other areas, so we're going to pass on her. And with that, we are out of time, Directors Peter and Stephanie, and I'll turn it back to you, Stephanie.
All right, thanks again to our panelists today for an excellent program to educate us about what's happening in water, sanitation, and hygiene. We appreciate your input. And for those of you on the call, I hope that you will mark your calendars for Monday, April the 5th at 1 p.m. when we will bring you another informative Zoomformation call for Rotarians and guests from zones 33, 34, and more. And now, as we typically do, I hope that you will join Director Peter and I as we lead you in the four-way test. Of the things we think, say, or do, is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? And will it be beneficial to all concerned? Have a great day, everybody.